Hi!
So I'm Suni Malucci.
I'm Mingy Beo.
I'm Monica Abad.
And today our topic will be about health issues here in the Philippines.
The objectives are identify different health issues affecting the Philippines
And how this affects the Filipino people.
As well as identifying the causes of malnutrition and how to prevent it.
And also identifying the causes of HIV, AIDS, and how to prevent it as well.
and other leading diseases in the Philippines.
Many of you are probably familiar with the health issues that we have here in the Philippines. Most commonly known are cancer, HIV, AIDS, malnutrition, dengue, and so on and so forth. Some of them which will be discussed by Ming and Monica. So going more into detail for malnutrition, which I'll be discussing today. Malnutrition is a condition that results from eating a diet in which nutrients are either not enough or are too much, which can cause health problems. Malnutrition increases the risk of infection and infectious diseases, and moderate malnutrition weakens every part of the immune system. Not enough nutrients is called undernutrition or undernourishment, while too much is also called overnutrition. Now, if undernutrition occurs during pregnancy or before the age of 2, it can cause permanent problems with physical and mental development. Also, extreme undernourishment, known as starvation, may have symptoms that include a short height, thin body, very poor energy levels, and swollen legs or the swollen abdomen. Now, here are some risk factors that you could get from malnutrition. No breastfeeding, gastroenteritis, pneumonia, malaria, and measles. Now we have here the different ways of preventing malnutrition. Improving agricultural practices, reducing poverty, improving sanitation, and empowerment of women. You're probably wondering how the empowerment of women can stop malnutrition. Women are clearly the most critical target group from a nutrition standpoint. So many adverse health outcomes like stunting are determined by the health and nutritional status of women and adults and girls. Now for further information, so here are some causes of malnutrition. Poor diet, mental health problems, mobility problems, digestive disorders and stomach conditions, and alcoholism. Here are some treatments. Replacing missing nutrients, treating symptoms as needed, and treating any underlying medical conditions. Now, all in all, the best way to prevent malnutrition is eating a good, well-balanced diet and as well as living a healthy lifestyle, and once in a while including sports into your daily life, as well as, I know it's hard, but everyone has to eat healthy food once in a while in order for you to get the nutrients that you might be missing, which can cause malnutrition.
Hey guys, I'll be discussing the main health issue affecting the Philippines recently, which is HIV, or the human immunodeficiency virus, which over time leads to AIDS or acquired immunodeficiency virus. According to a recent report from the United Nations just last August 2017, the Philippines has the fastest growing number of HIV infections in Asia. This is actually quite ironic since the Philippines is a Catholic country, but the nation saw a 140% increase in new cases from 2010 to 2016. And even though the annual number of the new infections in Asia Pacific declined by 13% over the same period, according to the report, Samonte even stated that there were indications of a rise in the use of internet and cell phones, which were allowing more and more young people to have multiple partners, further fueling the risk of contracting HIV. And she also stated that the cases will continue to increase and burden the Philippine health system if the nation does not invest in prevention and treatment. So we can see that it is really vital for every Filipino citizen to be aware of the preventive measures in order to fight HIV. And the government has done this by increasing the budget to fight the disease, and also directing its services towards MSM or transgender and women, and opening clinics in cities where the bulk of the new HIV cases were detected. In my report, we can see how HIV is a rising threat epidemically in the Philippines, thus showing how vital it is to be aware of the proper use of contraceptives in order to fight the disease. And it's a good thing that the government has made changes in this aspect by having sex education in schools and establishing clinics. However, HIV is not the only health issue affecting the Philippines right now. We'll have Ming to discuss the next health issue.
We are still talking about health issues. Did you know studies have found many health issues related to stress? So if you're stressed right now, you better start unwinding and relax because stress seems to worsen or increase the risk of certain conditions such as obesity, heart diseases, and so on and so forth. But before you get too stressed about being stressed out, let's talk about the leading diseases of the Philippines and other communicable diseases. Here are the leading diseases of the Philippines. We have asthma, breast cancer, kidney diseases, lung cancer, hypertension, tuberculosis, diabetes, influenza and pneumonia, stroke, and first on the list we have coronary heart disease. Let's focus on the top 5, which are the following.
Tuberculosis. Tuberculosis, also known as TB, has become more problematic as opposed to other lung diseases due to the increasing number of victims with this certain lung disease. Diabetes. By 2025, experts had predicted that the number of people with diabetes globally will exceed 320 million, but today's statistic shows that the number of people with the said condition has already reached a staggering number of 415 million. Influenza and pneumonia. In 2012, the University of the Philippines College of Medicine reported that pneumonia was the leading cause of death among children aged 1 to 4 years old. Stroke. Like the heart, the brain also needs an endless supply of oxygen for it to function properly. When a stroke occurs, a portion of the brain gets damaged because of lack of blood supply to that part of the brain. And on top 1 we have coronary heart disease. Dubbed by the former Department of Health Undersecretary Teodoro Herbosa as the silent epidemic, coronary heart disease-related death claimed the top spot of the deadliest disease in the Philippines at 16.86% of total deaths.
And those are the leading diseases of the Philippines. Now, some of the diseases that we have already discussed or mentioned are actually communicable diseases. What is a communicable disease? It is actually a process on which or how diseases spread, which depends on a specific disease or depends on the infectious agent. Some ways in which communicable diseases spread are by physical contact with the infected person, such as touch, sexual intercourse, oral transmission, or droplets. Here are some communicable diseases, some of which I might have already discussed or mentioned earlier. We have respiratory tract infection, pneumonia, diarrhea, bronchitis, influenza, tuberculosis, malaria, and dengue fever. These diseases occurs when you are not sensitive enough with yourself, with other people, when you lack personal hygiene, and you don't take care of the environment or your surroundings. Now, to prevent these diseases that we have discussed or mentioned, remember to always avoid being stressed out, and if you are, take time to unwind and relax. Be sensitive of your personal hygiene. Cut your vices such as smoking, taking illegal drugs, or drinking alcohol every night. Know that too much of everything is bad. And lastly, create a healthy lifestyle. Now we have come to the end of our discussion.
And I would just like to say the importance of knowing the preventive measures in order to avoid contracting HIV/AIDS, but at the same time not withholding yourself from enjoying life.
As well as I would like to share that you could still enjoy your life, eating whatever you want, whatever food, drink you want, just make sure that you are checking once a while if you're still in the healthy stage, and you also have to at least include healthy food in your lifestyle.
We hope you learned something, and remember that too much of everything will do you no good.